This is Dr. Nelson at FHE Health. Today we're going to be talking a little bit about grief. In the time of the coronavirus, a lot of us are experiencing grief and sadness, a lot of loss. Sometimes it's from people who are actually having the virus and do not make it. For others, it may be an elderly relative who's in a nursing home that we're not able to see. For a lot of us, our traditional rituals of dealing with death and loss are different. So for many of us, we might go to the hospital and maybe say goodbye to a person. We may have a family gathering where we're all together with hugs and hand-holding and being close to each other. And that's comforting to us. We have funerals, we have viewing, maybe a last look at the body and being able to say goodbye in a tender moment. But now we don't have those. And rituals are very important in people's lives. Weddings, funerals, baptisms, all kinds of different things. And even for those that are not religious, for a lot of us, we really face a challenge in closure and how to deal with a situation when we're not able to, in person, express our feelings and share our thoughts with those around us and with the person who may be passing away. So what do we do that's going to be different in this time period? What we do is we have to turn inside and look at ourselves, try to take care of ourselves in the midst of a loss, and connect as we can. Often it is said that funerals are not for the dead, but they are for the living. We gain our opportunities to be able to express our grief and to be comforted. For a lot of folks, this may be a spiritual process of being comforted. In the time of this virus, when we're not able to be close to the family that we'd like to be, what we do is we could reach out with a phone call, FaceTime. We can have a memorial on Facebook. We can take time to give ourselves spiritual time in meditation, thought, and prayer. For some of us, it may be writing a letter to a loved one who is gone so we can express our feelings. Closure is a process that happens inside of us. It is how we deal with something and how we process something. While it is much more common for us to do it with other people, the fact is that grief or loss is something we do individually. And for a lot of us now, we have to look at that, and some of the distractions and the other things that we used to do are not as important as actually taking the time to sit with ourselves, to cry, to grieve, to feel a sense of loss, and then to walk out of that, to be able to see the meaning or the comfort or the closure that we need to find in that particular situation. For each one of us, this is going to be unique. We can still reach out, but at the same time we can focus on ourselves. And in doing that, although it will take some time, we will be able to get through our grief and loss, and we'll be able to move forward.